I would like to begin by acknowledging the traditional custodians of this land. For me, that is the Wurundjeri people of the Kulin Nation. I pay my respects to their elders, past and present, representatives of the world's oldest continuing operating culture. The lead up to International Harm Reduction Day on the 7th of May is an opportunity to pause and reflect on what our communities need to live safe, healthy lives that they value. For me, I've reflected on the efforts of an extraordinarily challenging few years to maintain harm reduction support in our communities and recognise these as essential health services. From dealing with the challenges in the delivery of our needle and syringe program to our outreach workers delivering their usual services but also supporting vaccination efforts, to doctors and pharmacists ensuring continued access to pharmacotherapy. It is these efforts that have ensured that some of our most vulnerable community members have been able to continue to access the services that have kept them safe, healthy and alive. We have also seen the Department of Health working hard with our health services and other Victorian partners like the Victorian Poisons Information Centre to make sure that information about dangerous drugs is well communicated with the appropriate harm reduction advice. We have decades of evidence showing that harm reduction works, and thanks to the work of our practitioners and peer workers, this evidence base increases every year. In 2022, I was proud to see that the Supervised Injecting Room in North Richmond continued its life-saving work in providing access to services for people who inject drugs. We also have a new multidisciplinary outreach service in the CBD to respond to drug harms in the local area and support those who inject drugs. That's coming ahead of Victoria's second supervised injecting service. I'm also delighted to see our ongoing collective work to improve access to the life-saving drug naloxone come to fruition following significant advocacy from the sector. And as we implement the recommendations of the Royal Commission into Victoria's mental health system, we're working to create a future where the integrated mental health and wellbeing services and alcohol and drug services, including harm reduction services, become the norm, not the exception. We will continue to learn so much from harm reduction approaches as we go on this journey together to improve outcomes and eliminate stigma and discrimination in the community.